Hi, I'm Kevin from the Roth Lab at University of Toronto. Today I'm going to present MAVE Registry, a collaborative resource for sharing progress on multiplex assays of variant effect, or MAVE. Truly personalized medicine requires rapid and accurate classification of pathogenic human variation. Currently, in the ClinVar database, which is a popular repository of clinical variants, over 50% of clinically interpreted missense variants are classified as variants of unknown significance, or VUS. Having many VUS poses a heavy burden to the interpretation of personal sequencing variation, because, like shown here, we often take a reactive functional testing approach. When a new variant is observed, it is interpreted based on available evidence. Functional assay could be performed for variants that were interpreted as VUS, providing new functional evidence that might reclassify this VUS into pathogenic or benign categories. However, functional testing can easily take weeks to years to complete and might need to be repeated when new variants are encountered. There is a proactive functional testing approach that doesn't require time-consuming and resource-intensive individual functional testing. Instead, a systematic variant file mapping study is conducted ahead of time, even before many variants are seen in clinics. With this approach, when a new variant is observed, one can simply look it up in the variant file map, extracting functional evidence that may be sufficient for interpreting the variant without the need of laborious individual functional testing. This is one reason why systematic variant file mapping is gaining momentum globally. As shown here, we've seen an increasing number of publications in the recent years. International efforts in variant effect mapping are being launched. For example, the Atlas of Variant Effect Alliance focuses on supporting and coordinating investigations of human and human pathogen genomes. However, with researchers across countries and time zones, it remains challenging to communicate progress at this scale. There is a clear need in the community for a platform to effectively collaborate and communicate progress of ongoing variant effect mapping projects because such a platform carries many benefits. For instance, it helps reduce unintentional and excessive competition, foster collaboration, and attract interest from the general public and funding agencies. Therefore, I created MAVE Registry, a collaborative resource for tracking and sharing progress on variant effect mapping efforts. It offers 4 core functions. Researchers can browse variant effect mapping projects that were deposited by others, nominate targets for which a variant effect map they would like to see, register progress of their own ongoing or published variant effect mapping projects, and maybe most importantly, receive progress updates from other research teams they follow. One major concern from the community regarding sharing ongoing research progress is how to make sure these unpublished data are shared in a controlled manner. In response, we carefully designed a role-based permission model to enable user-controllable information access. We'd like to give everyone access to published data through links to MAVEDB, PubMed, and other sources. Signed-up users can register projects, follow projects and teams, and nominate targets. To make sure that researchers are in control of their unpublished data, only people that they had approved have access to their team and unpublished project activities and updates. Researchers also have the option to let trusted funding agencies view their funding needs for specific projects. Here is an example. Without signing up, the registry does not reveal any project detail or the team to which it belongs, unless the target is already published. Registered members can view basic project information as well as request permission to view project detail and receive progress updates. Once granted access, the now follower can view all posted project activities. Like mentioned previously, approved funders can view people's funding needs. Registered members can follow a team directly to get notified when a new project is registered on the registry by that team. They are also welcome to nominate targets for which a variant effect map they would like to see, and upvote or downvote any existing nominations on the registry. In summary, I hope I've convinced you that MAVE Registry, a platform for effective collaboration and communication of ongoing MAVE projects, addresses a challenge faced by the rapidly growing MAVE community. Feel free to check it out by searching MAVE Registry or visiting registry.varianteffect.org. I'd love to hear your feedback. Last but not least, I want to thank Fritz and members of the Roth Lab, as well as Laura, Alan, and Doug at CMAP for your amazing support and great advice. Thanks for listening.